Welcome back. June is National Infertility Awareness Month, and today, Dr. Kevin Moss, a reproductive endocrinology and infertility specialist from the Idaho Center for Reproductive Medicine, joins us now. And first of all, thank you so much for joining us here today on the News at 4.
Thank you. Thank you so much for inviting me.
Yeah, so how common is infertility among people who might be trying to get pregnant?
Problems with fertility affect over about 10% of the population, maybe even more as people delay starting their families.
Are there some common ways that people, you can become infertile?
There's a lot of different possible causes for why couples might have problems. Probably about a third of the time it's an issue on the woman's side, a third of the time it's an issue on the guy's side, a third of the time it's problems with both members of the couple. There's pretty good tests to kind of sort out kind of where the problem is, and then the treatment should target that.
I think some people might be watching right now and perhaps they might be experiencing this, or maybe they just are trying to be proactive. What can they do?
I think it's important to know when you should reach out to a healthcare professional. I think the big thing would be if a couple has been trying to conceive for about a year or longer, that's maybe a time to reach out and speak to a medical professional. Or there's certain, like if someone has certain pre-existing medical conditions or medical problems in their history, for example, if a woman doesn't have regular cycles, kind of implies that she's not ovulating regularly, and that would make it difficult. Or maybe someone who's had chemotherapy for cancer in the past, or has had other medical conditions that are known to affect kind of egg supply or sperm quality, sperm function.
You mentioned, reaching out to a specialist. What are some other steps that maybe someone can take if they find themselves in this situation?
I think probably the first step may be reaching out to their, maybe to an OB-GYN, or there are male fertility specialists like a urologist, and maybe discussing the concerns with them. Or obviously, you could set up consults with a fertility clinic with a fertility specialist, and usually that would involve, getting a basic medical history from the patients, doing some simple testing, and then based off of that, you can do more targeted testing to maybe find out the reason why there may be a problem.
You mentioned like 10%, right?
Mm-hmm.
I mean, what do you want folks to know who might be watching this right now and they find themselves in this boat?
Yeah, I think it's a much more common problem than people realize, but it's a very personal problem. A lot of this is tied into, individual or couples' view of how they perceive their lives going. So it can be a very personal kind of struggle that people don't talk about, but it affects a lot more people than I think most realize. So I think it's important to realize you're not alone. There are really good steps, very effective treatments. We can help almost anyone build a family. But the first step is realizing there's a problem and finding appropriate help.
All right, a lot of good information. Dr. Moss, thank you so much for joining us.